so you'll see how the problem...
Či na ten a pošleš to?
Využijem bejku, lebo potrebujem niekoho obstojnou lordovou.
So when you're working with a patient, have a look at them beforehand.
Keď pracujete s pacientom,
and realize where the problems are going to occur.
Tak sa pozrite na tú ich príčinu.
Because you've got this flat dorsal spine.
Lebo ak máte...
It's an interesting dorsal spine because you've got the extension and the flexion.
Máme tu extenziu a flexiu.
Yeah, so she's quite nicely balanced. So this is an extension, this is a flexion.
Toto je vo flexii.
This is her functional D9.
Toto je jej funkčná TH9.
But what you've got is that her functional lumbosacral is actually L3-4 junction.
Ale je...
Her functional lumbosacral is her 3-4.
L3-4 je funkčný LS prechod.
Which has shifted the lordosis up to here.
A to posúva tú lordozu nahor.
She's got a lovely back. You know, this is your functional L3.
Toto je funkčná L3.
But can you see that she's got a scoliosis, left side bending, right side bending, flexion, extension.
A vidíme, že to má nejaké skoliotické zakrývanie.
She's beautifully balanced.
Ja viem, len som mu podávala. Je dobre vybalansovaná, vyvážená.
But if I'm going to push her, so I apologize. If you push her, it doesn't matter where you push her, the movement's going to occur here.
Keď do nej šťuchnete, tak je jedno odkiaľ šťuchnete, všetky pohyby sa budú diať v tom jednom mieste.
So the difficulty is if you wanted to get to the 5,
čiže ak by ste chceli z 5-ke,
you've got to get through that.
Musíte sa prebojovať cez toto.
Hypermobile female patients particularly, they'll get pain in the ribs if you don't do it properly.
A hypermobilné ženy, ak to nenastavíte správne, tak máte v tej technike bolesť v rebrách.
Can I ask you one more time? You said left rotation?
Of which?
The lumbar lordosis.
Right, so here this is left rotated, this is right rotated. Yeah.
Left side bend?
So that's left side bend, left rotated.
Because of lordosis?
No, it's just looking. And I'm saying that that's what's happening.
Ja hovorím, že to sa deje.
I don't know until I test.
Ale skutočne to neviem, až kým si neotestujem.
So you don't go on that, but by looking,
ale už len tým, že sa pozeráte,
when you come to test, you've got a hypothesis to test.
Keď idete testovať, tak už máte aspoň nejakú pracujúcu hypotézu.
So I think this is doing that. Does it do that?
Myslím si, že toto robí daný pohyb. Potestujem si, že to naozaj robí ten pohyb.
So can you see that side bends? That doesn't.
Že to dole side benduje a to nad tým nie.
We go the other way.
A keď ideme naopak.
Yeah, and then it side bends. So that would be the gross active, which confirms my observation. And still I will then do passive segmental to make sure that it's the same pattern.
Ktoré by najprv teda potvrdilo, vyvrátilo tú moju prvotnú hypotézu a potom si to ešte pasívne segmentálne dotestovať.
Do you have a top? Yes, you must have a top because you were wearing a top. Because in the summer, you have to have something on the couch. Yeah, exactly. I always have couch roll anyway on the table. It's more hygienic. With a small patient, don't expect them to jump up on the couch.
Pri malých pacientov neočakávajte, že vyskočia na to lehátko. Prispôsobte to lehátko pacientovi.
Then put the couch up to where you want it.
Potom si zase zdvihnú to lehátko tam,
They can climb themselves. It's so much fun for them. Yeah, I know. I'm saying for the children it's the best.
Čom zdôrazne, že nemá rád byť.
Lift your head. The cushion again is not just for comfort. If I take this away, so can you see what's happening to the curve? Yeah, so it will influence the whole curve.
ovplyvní to zvyšky.
Attention to detail is really important.
Dávajte si pozor na detaily, alebo venujte pozornosť detailom.
But don't let the patient do what.
Ale nenechajte pacienta.
She corrected the pelvis position, but the shoulders too far forward now.
Ona si teraz zrovnala pánvu, ale to mi zase rozhádzalo ramena.
You're paying me, darling, so I'll do the work. Just bring the patient to where you want them.
Nastavte si pacienta tam, kde potrebujete.
Girdle square, girdle square.
Zrovna na pánva.
Parallel to the edge of the couch.
Paralelne voči lávku.
Try and make sure every time you do anything, everything is square.
Vy keď idete čokoľvek robiť, tak si to proste zrovnajte, uistite sa, že je to.
So that way, now when I do that, I know I'm tangential to her spine.
Som kolonou k chrbtici.
If she's skew width,
Ak bude hlava,
and I don't think about it, I'm going to be adjusting across her axis.
tak budem vlastne nabrávať cez tú jej os.
So if I'm doing that movement,
A budem robiť tento pohyb.
it's going to approximate across the two facets. Does that make
Tak
sense?
sa budem približovať tie dve facety.
Let me show you.
Skúsam to vybrávať zmysel.
If the patient is there,
Ak je pacient takto,
and I'm not aware of it,
a ja o tom neviem,
and I'm rotating her in this direction,
a ja si ju rotujem,
I'm going to be cutting across two vertebrae.
tak budem prekázať tie dva
So
stavce.
blocking here and here. If I bring her back into where I want her,
Ale keď si ju zrovnám,
then I know that as I do that, I'm exactly in line.
tak budem vedieť, že keď budem robiť tú rotáciu cez jednu páku, druhú páku, tak budem tam, kde chcem byť.
So the first thing that